Thank you to our presenters for being part of the Joining Forces initiative. We welcome you to this webinar, Taking a Military Health History, 4 Critical Questions.
Thanks, Marcy, and welcome to all our participants and viewers today. On behalf of the panelists, may I offer our gratitude to all our veterans on this Veterans Day today. As we speak, there's a contingent of our Marines that's being deployed to the Philippines to do what they do best, and that's to help those in need. Today's panel, as we heard, is devoted to the medical history and asking of 4 critical questions to help identify a veteran or veteran's family that may be having issues related to deployment. There'll be a short, about 13-minute introductory video, followed by a presentation by Dr. Jeff Brown and Harold Cudler. So without further delay, why don't we get right into the webinar, and may I ask that you all watch this short video, which will be followed by the presentations and then an opportunity for you to participate. So if you will go ahead and show that, I think we'll be all set.
The great Sir William Osler once said, "It is important to know what sort of patient has a disease rather than what sort of disease a patient has." And by that he meant, when you take a medical history early on, you need to classify patients into high risk and low risk for given disorders. And to do that effectively and efficiently, you need to ask key questions that allow you to do this. For example, would you ever take a medical history and not ask about smoking? Of course not. Smoking is a key question, and if the answer to that is yes, you then ask about heart disease, lung disease, vascular disease, claudication, etc. It's a key discriminatory question. Let's look at the following short video where Dr. Jeannie Kelly meets a new prenatal patient. She's using a commercially available electronic medical record that has been pre-programmed with a series of questions. As you watch, ask yourself, has the doctor missed any key questions? If so, what were they? And most importantly, when you take your next history, will you miss those very same questions?
Hi. Nice to meet you. I'm Jamie Smith.
Please have a seat. So what brought you into the hospital today?
Well, this is first appointment for me. I'm pregnant, and I decided I better get in to see a doctor. I'm actually not sure how far along I am.
Okay. Well, welcome to our practice. This is an intended, desired pregnancy, I'm assuming.
I'm still kind of adjusting to it and getting used to it. Definitely something new.
Of course. How have you been feeling?
I've been feeling very fatigued lately, low in energy. I've been having a lot of trouble sleeping too, just nightmares, and I really haven't been very hungry, not much of an appetite.
Okay, welcome to pregnancy. These are all, unfortunately, very normal symptoms of pregnancy that you've been having.
Is it normal? It's normal?
It can be very, very normal.
Okay.
So tell me, do you know the date of your last menstrual period, the first day of your period?
No, it was a long time ago. If I had to estimate, maybe around 13 weeks ago.
13 weeks ago, okay. So you may be about 13 weeks along, but we'll get an ultrasound and we'll verify the dating by the signs. Okay, so give me 1 second. We have this new electronic system. We're all learning a little bit, so I apologize. Let me get this kind of keyed up here.
Sure.
Sorry, it's really slow.
No problem.
Okay, so tell me a little bit about yourself. No past medical history, ever been admitted to the hospital, anything like that?
No, I've never had any major surgeries, and I've always been healthy, very lucky.
Oh, great. That's really, really good to hear. And tell me a little bit about your obstetrics and gynecology history. Is this your first pregnancy?
Yes, it is.
No history of miscarriages, terminations, that you know, nothing like that?
No, nothing like that.
And then, do you remember the date of your last pap smear that you've had?
I would say about a year ago.
A year ago? Okay. Have you ever had an abnormal one?
No, I haven't.
Okay, and that one was normal as far as you can remember?
It was.
Perfect. And then, have you ever had anything like a sexually transmitted infection, like herpes, gonorrhea, chlamydia, anything like that?
No, never anything like that.
Do you remember the last time you were tested for those?
I believe that they did a routine test, a battery of tests for the sexually transmitted diseases at my last pap smear.
Oh, perfect. And then, are you taking any medications right now?
No medications.
Prenatal vitamin at all?
No.
We should probably get you started on those. I'll give you a prescription for it today, okay?
Okay. Is it bad that I haven't been taking one?
We like to start people before even they get pregnant, but right now, we can go ahead and get started on it. Usually it's not a big deal if you haven't started on it.
Okay. All right.
Okay. And then any allergies to medications?
No allergies.
Perfect. Great. Okay. So is the father of the baby involved at all?
No, he's not. I'm not seeing him anymore.
You're not seeing him anymore?
No.
Do you live with anybody right now?
No, I live by myself.
Okay. And what do you do here?
So I'm a cook at a small restaurant.
Cool, okay.
And I hope eventually to go to culinary school.
Wonderful. I'll have to stop by at the restaurant sometime. Do you like your job?
Yes, I do. I really enjoy it.
Fantastic. Do you have a good amount of social support here in the area? Do you have friends, family?
I do.
Great.
My mom and dad live close by.
Oh, great.
And I have a lot of close girlfriends.
Oh, great. And they've all been pretty supportive of you during the pregnancy?
Yes, they've been great. Phenomenal.
Fantastic to hear. Okay. And any smoking at all?
No smoking.
Okay. Prior to the pregnancy, no smoking?
Nope. I can't stand the smell of smoke.
Yeah, that's a good thing. Any drinking at all?
Maybe a glass of wine here and there. Very rarely, though.
Okay. Any drinking since the pregnancy started?
No.
And then any drug use now, previously, ever in your past?
Oh, no.
Good. So do you have any questions for me?
So I've been having trouble concentrating, and I've been nervous driving a car. Is that normal, or?
Being tired, having trouble concentrating, a lot of people complain of that, especially in the first trimester. Do you have any thoughts of hurting yourself or hurting others or anything along those lines?
Oh, no.
Okay, perfect. No history of depression or anxiety or anything like that you know of? No
history of depression. I've, been feeling a little bit jumpy and nervous lately. Sometimes I feel anxious when I'm alone sometimes.
Okay.
but I just, I don't know what's wrong. I don't know what to make of it.
Yeah, sometimes that can be, you're in a very new situation. There's a lot of emotions floating around, especially since I know it seems like it was unplanned, and especially since the father of the baby is not in the picture. It's a daunting task to be pregnant, but that can be also very normal in the first world. Fantastic. Let me do a quick exam on you. It's going to be just a heart, lung, abdominal exam, and a pelvic exam. We will try to also see if we can hear the heartbeat of the baby, and see if we can grab a quick ultrasound as well to make sure that the dates of the baby line up.
Okay. All right.
Great. All right, so I'm going to just take a listen to the baby now, okay?
What is that?
Oh, this is just a Doppler. It's something that measures blood flow.
A Doppler?
A Doppler. So,
I thought that measured weather.
They also do that, but we use it to measure heart rates of the baby, and it's just an ultrasound, more or less.
Okay, all right.
All right, makes a big noise when we turn it on. Sorry, it's really loud.
It's all right.
Great. The baby's heart rate is totally normal. Okay?
Oh, good. So that's how we're hearing?
Yes.
That's the baby's heartbeat?
That's correct.
Wow.
So everything looks totally normal. The heart rate sounds great, so you can go ahead and get on up, okay?
Okay. Thank you. Thanks.
Let me just help you out here. Oh, what happened to your leg there?
Oh, I just fell, was clumsy and scratched myself pretty badly. I had to get stitches, but seems to be healing up pretty well now.
Sorry to hear that. Did you get your tetanus shot and everything?
Yeah.
Perfect.
It's fine.
Well, go ahead and have a seat. Basically everything looks completely normal today. So everything looks great. We will get some blood work from you today to send off kind of the routine prenatal labs. And that'll be it. And we'll see you back in 4 weeks. Okay? Do you have any other questions for me?
So everything looks fine now, but in the future, if anything happens, I can call or come in.
They'll give you my card at the front desk. My number is on there. Feel free to call at any time. Okay? There will always be a doctor on call for any questions that you have.
All right. And it's, like you said, it's all right to feel nervous and anxious. It's a mark of pregnancy.
Absolutely. If ever that gets out of hand for you, if you ever suddenly feel overwhelmed from feeling anxious or, just kind of generally emotional about everything, please give us a call. We can see you again and kind of talk about that and see what's going on. Okay?
Okay.
All right. Well, congratulations.
Thank you so much.
Hey, you're done.
Hey.
How'd it go?
It went well. She was really sweet, really nice.
Good. Did you feel comfortable with her?
I was a little bit nervous, but I just don't like doctor's offices.
Did you tell her, though?
No.
Nothing?
No, I didn't mention it.
Not about Afghanistan, the roadside bomb?
No, not any of it.
Oh, sweetie, why not?
She didn't ask.
You notice during the course of this, she's acting very anxiously, very nervous, looking about. She's having trouble sleeping. She's actually given a number of symptoms which are quite routine symptoms for pregnant women. And if someone doesn't bother to ask about military history, you might kind of shrug these off as, well, that's what women get when they're pregnant. They don't sleep and they can't eat and they're anxious and whatnot. It's very easy to be dismissive, but once you realize that this was a vet who was just returned from a battle zone and in fact was injured, everything changes. That was the essence of this video, and it's meant to introduce the whole topic of asking the questions. So I think we should, at this point, turn it over to the presenters. I think Jeff Brown, is he the one to get it next?
Yes, I think
so. Yeah, so it's all yours.
Thank you. So first I'd like to thank all of you for attending on this Veterans Day, and I'd like to thank Henry for this presentation because it did make some very important points. And this topic has been important to me personally because when I came back from Vietnam, I found that I never had a single instance where a civilian doctor asked me if I had served in the military, and the fact was that I do have medical conditions that may very well have been related to exposure to Agent Orange. So we're going to be talking about some of the reasons that it's important for physicians of all specialties and other healthcare providers to be asking these questions of veterans. A lot of the reason that they don't is because there are a series of misconceptions. And as a result of that, one of the weakest links in veterans healthcare, everybody is focused on the VA, but one of the weakest links is actually community health. And that's because 1 of every 10 adults has served in the military. Only 28% of them receive any portion of their health care from the Department of Veterans Affairs. But veterans are generally not identified by community providers because most physicians don't routinely ask if you or someone close to you ever served in the military. So a patient's prior military service can affect which of these: past medical history, present medical history, social and family history, occupational history, psychiatric history, preventive medical screening and guidance. And the answer, of course, is all of these. And the reason that much of this has come about is because many physicians and healthcare providers have a misperception that community physicians don't treat very many veterans, and secondly, that all service-related disabilities that veterans may have are already being treated at VA facilities. So military health history and veterans cultural awareness have not been included in most healthcare teaching settings, including and especially in the medical school curriculum, so that a lot of doctors really aren't aware of which questions are important. And even though up to 70% of U.S. medical school graduates rotate through VA facilities, there's no mandatory training that they receive on military history taking or cultural awareness during these rotations that carries through. Also, many physicians feel disconnected from military issues. They think that anything that has to do with the military doesn't pertain to them. And when they do get an affirmative answer that someone served in the military, they're not quite sure what questions they should be asking or what the follow-up should be. Also, of real importance is the fact that most electronic health records do not include military health history as part of the questions that physicians and other healthcare providers are prompted to ask. So as a result of this, the consequences are that there's misdiagnosis and missed diagnosis of patient complaints. Things that relate to specific deployments may cause symptoms, and if the physician isn't aware of them, they would never consider, for example, that Gulf War syndrome might be a cause for abdominal pain, chronic fatigue, myalgias, and so forth. Second consequence is that eligible but underinsured patients may not receive care and benefits to which they're entitled because they don't know that they're entitled to these benefits or that their conditions are service-related. And it creates an inability to track data that would identify service-related conditions, including presumptively service-connected health problems. So it took almost 25 years for many of the conditions associated, now known to be associated with Agent Orange in Vietnam, to be identified. And this would have been picked up much sooner if patients who had served in the military had in their medical health history the fact that they had served. So veterans have special problems, especially transitions from civilian life to military life and back. There's a major change in culture when you enter the military, and then when you return to civilian life, it's sometimes very hard to get into the mindset of being a civilian, and you also lose some identity issues where you came to think of yourself in a certain way. All of a sudden you're back in civilian life, and you may have lost your niche. There's an intensity of personal experiences that becomes part of your intrinsic persona, and many people suffer from physical and mental stress as a result of their military experiences. They've traveled to other places, and they really have a diverse risk of exposure. About 20% of combat veterans develop a diagnosable mental disorder within a few months after deployment, and almost all of these face significant stress, but only a third of them who screen positive for mental health issues seek help. And there are many reasons for this. Some of them are cultural, some of them are because people feel and understand that they're not acting right, but based on the past experience they have, to them they seem normal, and so they don't try to get help as a result of it. Their spouses face challenges related to the worries of physical harm to the combatant, redeployment, changes in household roles, separation, and loneliness. And 2 million children have been affected by at least one parent's deployment to Iraq and Afghanistan, and 40% of them were less than 5 years of age at the time of deployment. About 80% of them are under the age of 11. So who makes up the veterans population? First is that male veterans comprise about 20 million people. Their median age is greater than non-veterans at 64 because about a third of them are from the Vietnam era at a time when there was a draft in place. Female veterans have about the same median age group as non-veterans, and the youngest group of combat veterans is underrepresented because many of the younger people are still in the military, so they're not classified as veterans yet. Caucasian veterans tend to be overrepresented, and Hispanic members tend to be underrepresented. Male veterans are more likely to be married than non-veterans, partly because they're in an older age group. And female veterans are married in equal percentages to non-veteran women, but most important is that they're twice as likely to be divorced as non-veteran women. And this is important because it may impact on the need for family counseling and social services. Contrary to common expectations, about 80% of female veterans have completed some college, and that's true for about 61% of male veterans. And a higher percentage of female veterans than male veterans in all age groups are enrolled in college once they become part of the veteran population. Male and female veterans are twice as likely to work for local, state, or federal governments. That means that about almost a quarter of male veterans and about 38% of female veterans work for some government-related entity. And this is important because it means that a very large percentage of them are going to have insurance that is going to be generally very good coverage. Veterans of both sexes have higher personal incomes than non-veterans, which also contributes to the fact that many of them are going to have good insurance coverage. And that's one of the reasons that these veterans are seeking care from non-VA sources, is because they do have good insurance. That means that they're going to be coming to you, and you need to recognize them as part of the veteran population, because they're going to have problems that may be different from some of your other patients. Looking toward the future, about 25 years from now, it's expected that the veteran population is going to drop. The percentage of females is going to increase, as will the percentage of blacks and Hispanics. And the percentage of Gulf War era veterans, of course, will increase at the same time that Vietnam era and World War II and Korean veterans will decrease because they will gradually die off. The most common symptoms that veterans have are musculoskeletal complaints, other forms of chronic pain, and mental symptoms including PTSD, depression, and anxiety. And some of these are going to be related to either their past deployments, and some of them will be related to their job description. So depending on what their job description was, which is one of the elements that you may want to ascertain. If they tell you that they've been in the military, it may influence the kind of conditions or complaints that they're going to have. About 16% of veterans have a known service-connected disability, and about half of these are rated at above 50% and about half below 50%. So the reasons that it's important for you as medical professionals to identify patients who are veterans is first because it's professional, it's necessary for good patient care. If you don't take a military history as part of the other questions that you ask your patients and identify patients as veterans, you're not really fulfilling your responsibility to them as good medical care. And the other is that these individuals serve their country, and it's your responsibility to repay them for their service. But how do you know which of your patients have served? Sometimes you can tell by looking at them, as you can in these pictures, but more frequently you can't, and they look just like your other patients. These patients in the waiting room look like any other patients, and their doctors don't know if they served unless they ask every patient if you or someone close to you ever served in the military. And you ask that because sometimes it's a spouse who actually was the person who served. Looking at this woman, can you tell if she's a veteran? Her doctors don't know because they don't ask every patient. She may have served in Iraq, and she might have PTSD, depression, or military sexual trauma, and they were never considered as possible factors in some of her medical complaints. Did these patients serve in combat? Their doctors don't know because they don't ask every patient if they or someone close to them served in the military. They might have served in Afghanistan, and their symptoms of anxiety, depression, poor concentration might have been caused by PTSD or TBI. Frequently, veterans, especially those in combat, don't share that information with their doctor unless they're specifically asked. When you look at these older men, you don't know if they're veterans unless you ask them. And many of them develop diabetes, ischemic heart disease, and prostate cancer, which are just a few of the diagnoses now associated with exposure to Agent Orange. They may also have been eligible for veterans benefits, but only if they're identified as veterans and referred to the VA. When you look at pregnant women, as the patient that was in that previous video, their doctors don't know if they served in the military, and now 15% of active service, active duty personnel are women because they don't ask every pregnant patient, did you or someone close to you ever serve in the military? They may be at risk for complications of pregnancy or birth defects because of toxic exposures to them or to their partners during military deployment. For example, Agent Orange exposure was associated with a higher incidence of birth defects in women exposed to Agent Orange, but men exposed to Agent Orange had offspring with a higher incidence of spina bifida. But no one will know if they had these exposures unless military service history was included in their history. When you look at these families, you can't tell if they are post-military families because they don't ask every family member, have you or someone close to you ever served in the military? So this is very important because children of veterans are at higher risk for a variety of psychological problems, and the families themselves are at higher risk for issues as well. The same is true for emergency patients. If you don't ask them if they served in the military, some of them, especially the ones that are underinsured, may have undiagnosed service-related disabilities, and some may be eligible for VA medical care, disability benefits, hospice services, or care for the elderly through the VA. So doctors and other healthcare professionals don't know when they're treating veterans unless they ask every patient, have you or someone close to you ever served in the military? And you'll have to remember that some patients who are veterans look like they're veterans, but most veterans will look like your other patients. 1 of every 10 adults serving in the U.S. is a veteran. 1 of every 6 men between the ages of 35 and 65 is a veteran. Fewer than 30% of veterans receive health care within the VA system. The rest receive all their care from traditional civilian sources. The message here is that you should not make assumptions, and you should ask every patient if he or she or someone close to them has served in the military, and this history should be included in their permanent health record. I'm now going to pass the microphone on to Dr. Harold Kudler, and he's going to discuss some of the specific questions that need to be asked.
Thank you, Jeff. Let me start by acknowledging that we are meeting today and speaking as we're speaking because of last year's webinar by the AAMC, after which I called Anita Navarro and found out she was already talking to Henry Klappholz, and all of us had read Jeff Brown's really wonderful commentary in JAMA that had been published in connection with that Veterans Day. Together, we decided we needed to move forward as a committee. And what we're going to share with you represents what we've been able to do since then. I'm having a little trouble advancing the slide. There we go. All right. And we got together and created a project about asking the question, documenting the answer, and making a vital connection. We call ourselves Ask, Document, Care. And this has become an AAMC military history project, and it's an ongoing one. I want to thank and recognize the contributions of Anita Navarro, who's really been the leader of our team, gotten us together, coordinated us both with the AAMC and joining forces, and also Dr. Prescott of AAMC, whose support for this project is what made it possible. A little later, we're going to talk about how we've really started with some wonderful direction by the VA Office of Academic Affiliations in their pocket card, which will be sort of my concluding slides. Our vision is pretty simple: to improve the care provided to service members, veterans, and their families, and also others that are close to them. Remember that you have family members, you have people you live with, you have people that you work with, and very often they're deeply involved in your lives and affected by the things that affect you. Not everyone has legal status. Many people might be living together, might even have children together, but not be family in the eyes of the law. So don't get too restrictive in your sense of who's family. The question is others close to you. And I want to emphasize the other reason it's important, not just to ask, have you ever served, but have you or anyone close to you served? As has been pointed out, there are about 22 million living veterans. 1 in 10 adults is a veteran. But there are 60 million Americans who are either veterans, people who have served in the military, and then there's another 40 million people, total 60 million, that are dependents of veterans, eligible for some form of VA services. So put it together, 60 million Americans is 1 out of every 5 men, women, and children in the United States that you will see in your practices, hence the importance of asking this question. So our vision, ask them all, raise awareness among medical professionals and trainees about the health implications of military service, the resources available in VA, in DOD for retirees, and across our nation, and the importance of documenting this. As you all know, if you ask the question but don't document it, it's almost the same as not asking the question at all, because it will not be helpful when that help is really critically needed. Document it in the patient's electronic health record or whatever version of the health record you're currently keeping. Our objectives are not to give you another hour's worth of wonderful questions we think you ought to ask. Nobody needs more work. We know that quite well. To ask as few questions as possible in order to assess the impact of past service on physical or mental health, to consider changes to the patient's preventative health plan, and to make referrals to other physicians and services, including if you're working in the private or public sector, to make referrals to VA or perhaps with a retiree to the Department of Defense or TRICARE, when people may be entitled to those services and perhaps not able to access care except through those services, which they've earned but may not even know they're eligible for. This is particularly important, as Jeff has pointed out, when the patient's underinsured. To support documentation of relevant medical history, to record findings in the record in a manner that optimizes collection and analysis of pertinent data and ultimately improves care. Finally, to offer resources and training in meeting the unique health needs of those who have served and remembering that their families and their loved ones have served along with them in many, many ways. The strategy is pretty simple. Every patient in every practice should be asked sometime in some appointment, hopefully during the initial assessment, have you or someone close to you served in the military? If the answer is no, end of questions. However, it's important to then document if the answer is yes, and say who it was. Was it the self? Was it the spouse? It may often be both, especially in these wars. We're seeing a lot of husbands and wives who have both deployed to Iraq or Afghanistan. So ask about that. But it matters if you're the parent of someone who's deployed. It matters a great deal. It matters if you're the child of someone who's deployed. It matters if you're a sibling or a lover or a best friend. These things matter, and they're worth recording. Next question. When did you or he or she serve? Noting multiple times, if it's applicable. Think of it this way. A lot of people will serve, say, in the Marine Corps and then become a member of the reserves. Or they may eventually leave the Marine Corps but sign up to be a member of the National Guard. And therefore, they may deploy again, but it might be 20 years later. A lot of Vietnam veterans have served in Iraq and Afghanistan. And it's important to know about both because you otherwise won't understand the health history and the health risks and the kinds of exposures specific to different deployments. Now look, I'm not asking you all to know everything about American history. I'm not asking you to stay up nights and watch the History Channel and learn all about this stuff. You don't have to. But you can simply ask questions divided, as we've said, and document. When did they serve? Was it prior to 1939? That's before World War II. Was it in the 1940s? Likely served in World War II or an occupation in Europe or in Japan. Did they serve in the 50s, perhaps the Korean War era? In the 60s, during the missile crisis or the early days of Vietnam? Did they serve in the 70s, later Vietnam, or through 79? How about the 1980s? Maybe lead up to the Gulf War and Panama, Grenada. 1990s, first Gulf War. The current wars in 2000 to 2009. And, of course, the wars are ongoing since 2010. They may have served in multiple eras, so you've got to ask more than once. Where did you serve, you, he, or she? And again, you don't have to know everything about everything. We've broken it down pretty simply, following guidance that's used in VA and actually in DOD. And you don't have to guess. You can ask them. Did you serve in Europe, Japan, the Philippines? World War II was different depending on where you served and the health risks and exposures, as you can imagine. Tropical medicine applies if you served in the Southeast Asia than if you served in Europe. But there are effects in both areas. Korea, Vietnam, Grenada, Panama, Somalia. These are all things to ask about. But to continue, what did you do in the military? What did you, he, she, or she do in the military? And believe me, they may tell you a code and you won't know it. Just say, well, tell me about that. That's all you have to ask. In fact, a lot of medical people kind of feel awkward about not knowing what somebody means, not knowing the answer to something. In this case, asking when you don't know is one of the key elements in making the other person feel at home, putting them in the driver's seat, which often makes them feel much more comfortable, and letting them explain what they do to you. And by the way, please don't make assumptions. Someone could serve without ever going overseas during a war, but be doing some very dangerous things, and they've all put themselves in harm's way. You know, a person may tell you, I served in Dover, Delaware. And you say, well, at Dover, Delaware, there was no war in Dover, Delaware. They might have been the person receiving bodies from overseas in Vietnam or Iraq or Afghanistan. And believe me, they have a significant exposure to the real outcomes of war. It's important to ask what they did. So please ask and be curious. This does not take a lot of time, and it's valuable information that you can use. The next question, and has your service or his or her service affected, in your own opinion, the patient's opinion, has it affected your physical or mental health, or your family life, or your work, or some other aspect of your life in a meaningful way? It's up to the patient to decide yes or no on this and record their answer. And it's simple, it's yes or no, but there's room for free text in saying, this is how. It may not be relevant to the current appointment, it may not be something the patient themselves has ever really thought about, but it may be part of an evolving story. And if you don't ask the question, that story may never evolve to where it's useful to you and the patient together. Finally, ask if the patient or the family member is receiving VA or Department of Defense or TRICARE healthcare or benefits. Again, I don't ask you to be an expert on these programs. TRICARE basically is a health program set up for active duty military members, Guard and Reserve military members, and their families, which retirees can follow the rest of their lives. So just ask about it, ask them how it's going. That's all you need to do. Over time, believe me, you'll learn a good deal by being taught by your patients, which in the end is a very good way to learn about medicine. You don't have to know everything about the military, and believe me, nobody knows everything about the military. Even if you knew a great deal about the Army from 30 years in the Army, you really don't know that much about the Marine Corps, the Navy, and certainly not about the Coast Guard. So don't worry about knowing everything, and don't be embarrassed if you don't. You simply need to ask, you need to respect what people have to say, and you need to care. You don't prove your care by being effusive or by pretending to know all about it. The best way to show that you respect and that you care is to listen and to ask when you don't understand something, because that shows you really want to understand. That's what you have to convey, and of course, that matters a great deal to a patient. Part of military culture, the part that keeps that 60 million Americans invisible in the eyes of their doctors, is that in military culture, you don't whine. You always believe that the other person has more on their plate than you do, and you don't take the care that they should be getting by saying, I need this. You let the other person have your place. You don't talk to people outside of the military unless they seem to be understanding of the military and interesting and accepting. And that's what you would have seen at the end of Henry's video, where the patient says, my doctor never asked, which in the patient's mind means my doctor obviously wasn't interested or they would have asked. My doctor doesn't care about the military or they would have asked me this question. That's the way the military people see it. So do their family members. So the VA Office of Academic Affiliations has created a pocket card, which you can get a copy of, that provides you with key information that you need to have to make sense of your findings and, if necessary, make the right connection for you and your patient with VA. Here's the card, and I'm not going to read this card to you. I hope you'll read it in your own time. And by the way, if you'd like to download the PDF and share it with your entire class or your buddies or post it on a website, the VA welcomes you to do it at the website I've shown you here. You can also get hundreds or thousands of copies of this card if, in fact, a hard copy is really needed. But basically, this goes into some detail, the general questions, how to ask, a little more information about the issues you want to ask about, the kinds of exposures, things like chemical reactions or biological exposures, and how to ask about these, including hepatitis C and living situations in the military and stress reactions. The opposite side of the card takes us even further. Specific exposures during the Gulf War, during Vietnam, during the Cold War. Well worth asking about. And just taking a look at this once could open your eyes for a lifetime of informed care. I also want to point out that there are a number of resources in the VA. VA has been doing really a terrific job of projecting itself into the communities and partnering with community providers. But this is just beginning. And just because you rotate through the VA doesn't mean you learn everything you need to know about caring for veterans. These websites can help. The first is a special website created by VA for community providers to teach them about VA and about veterans, and when they have an issue with a veteran, to help them get the right help, to make the right referral, provide the right care, and to coordinate care with VA. MakeTheConnection.net is a website you can give to any veteran or a family member who's saying, I've never used the VA, I'd like to know how. As Henry mentioned, and Jeff too, only a minority of veterans are currently enrolled in VA About 39% are enrolled, only 28% use it. So talk to them about it, and this can help them understand and make that connection for them. The next website is an official list of veteran service organizations, state by state. Every county in the United States pretty much has a veteran service officer whose job it is to help people figure out how to fill out forms, fill out the forms with them, file them together, make appeals if appeals are necessary, and get them connected with the right care, get them the right support in the community. If you have questions about PTSD, the single most common mental health problem coming out of combat in any war, then the VA's National Center for PTSD is the world's most sought-after resource and has every kind of education and tool you can imagine for assessment, for general education, for handouts to the veteran and their family. It's all free and in the public domain and yours to get. And finally, you've got a veteran in crisis or a family member who feels there's imminent danger, or someone who's becoming homeless, or even a question that you as a provider need to ask. The Veterans Crisis Line, call 24/7 and get expert help on the spot with follow-up in your community. It's a national call line with follow-up right in your community. So call that number if you need help. And I'll pause here on behalf of my whole team and open up the conversation for questions, comments, and suggestions to any or all of us or to other participants. Again, thank you for being a part of this call, and thank you for kind of joining our calls.
Thank you so much to all of our presenters. A reminder, if you are calling in, to please put yourself on mute. And if you have any questions and comments at this time, please feel free to type them into the Q&A. And we will hold for a few more minutes to see if any questions come in. Gentlemen, thank you so much for presenting for us today. This is Anita Navarro, and it has been a pleasure being part of the team that we've been on to work on this issue. Just wanted to see if you could comment on how reservists and Guards folks factor into being aware of military patients in your practice.
This is Harold. Let me try to field that question. And it's a very important one because about 40% of folks who served in Iraq and Afghanistan were members of the National Guard, which is a state-by-state organization which can be federalized, put into duty in a war by the president if the president chooses to call them up, and or reservists. All the military branches, Army, Navy, Air Force, Marines, Coast Guard, all have a reserve component, and reservists from every group, including the Coast Guard, have served in Iraq and Afghanistan. But it's kind of odd because they might serve a year or 15 months overseas. When they come home, very quickly, they are out of the military and back in their community. And it's very possible that you're going to see a patient in your clinic who just spent the last 12 or 15 months at Iraq or Afghanistan, but they're not in uniform, they are not currently in the military, and you will not know, and they may not tell you, that they spent a substantial part of the time since they last saw you, they were across the ocean in Iraq or Afghanistan fighting a war. Same with their children. May not say my father was overseas, or someone may not say my child was with the Guard and Reserve and overseas. It's really important to ask this question and understand what the Guard and Reserve do in our nation.
So there are some questions about the availability of this webinar. We will be posting this webinar as well as all of the presentations in our webinar series for Joining Forces Wellness Week on the AMC Joining Forces website. So if you go to amc.org and type in Joining Forces, you'll be able to access the presentations from today and this week. And we'd be happy for people to access them after the fact. We are working to get them up as soon as possible after the presentation, hopefully at least by tomorrow for today's. So I hope that helps those questions that have come in about that. There's also a question about why are not more veterans enrolled in the program? Would one of our panelists like to tackle that question?
I think that we address it to some degree. That for a starting point, a very large percentage of veterans are not disadvantaged, and the ones who are not disadvantaged frequently have private health insurance through their own employment or through the employment of their spouses. And so as long as they felt that their problems were being covered and that their health care needs were being met, they didn't see the need to enroll in the VA. Secondly, as we also mentioned, many of those that do have service-related issues don't realize that they're service-related. They never made the association between a specific deployment and a condition that they have, frequently because the doctor never brought it up either. And because they don't think of it as being service-related, they don't sign into the VA. And then lastly, there's a cultural aspect where younger veterans, for example, although many of them have in fact enrolled in the VA, don't consider themselves to be veterans. They don't like that word, and that's one of the reasons that that we use the phrase, have you or someone close to you ever served in the military, rather than use the word veteran, because especially people in a younger age group don't think of themselves as being veterans. They think that veterans are people in my older age group.
Thanks, Dr. Brown. We have one more question that you might speak to as well. Could you speak more about the impact of child mental health and the increased utilization of pediatric services based on parents' military service? As our resident pediatrician, Dr. Brown, would you like to take that one too?
Well, I would just say that it appears that the children that have the greatest mental health issues are those whose parents participated in prolonged deployments. So there are a couple of major trigger times. One is that if the parent is engaged in a long deployment, the kids are worried about the physical safety of those parents. They're separated from the parent for a prolonged period of time. The spouse who's remained at home, which might be of either sex, may have had to change their job depending on where their military spouse is deployed. So it's very disruptive to these families in general. And many of them, in fact, are eligible for care if the kids are having school-related problems, if they're having problems of depression or acting out. Many of them really can receive care either through TRICARE or through VA services. And many of them just don't think of presenting these problems to their pediatricians or to their family practice doctors when, in fact, they certainly should.
Marcy, can I say a word? Ms. Henry.
Sure, absolutely.
Yeah, no, I just wanted to, before we finish, I just wanted to make one point that you all can help with, all of our listeners, and that is the electronic medical record. You know, if your electronic medical record does not contain that question, I urge you all to tell your clinics and hospitals to contact the vendors and have this added, because that serves as a cue, as a reminder to ask the key question about military service. One of the benefits of the EMR is education, teaching students the right way to take a history, teaching residents, and I think it's an important issue. So if your own EMRs do not have that question, call the vendors right away, ask them, demand that that be put on there.
And may I add to this, as Harold, that there's a point of urgency which today's medical students could play a major role in. And that is that everyone who comes back from Iraq and Afghanistan, active duty, Guard, or Reserve, have 5 years from the time of their last deployment to get enrolled in VA without any question. Say I come home and I'm in the Guard or Reserve, or I leave the military and I get a really good job. I'm not service-connected, which could take some time, months or even a couple of years sometimes, to get that service connection paperwork through. But I've got a problem that I think may be related to my service in the war. If I walk into the VA within those 5 years, and then I can get signed up, and the VA will never let me go. I will be signed up for life, and I can get care for anything related to my military service as long as my doctor says, yeah, I think this problem is related to military service. But if you and the community don't send people toward VA within that 5 years, they show up 5 years and 1 day later, it may take them a year and a half or 2 years now to get into VA and get the services they need. So please, remember that clock is ticking. This is something essential you can do for all these veterans and their families, and medical students are in great position to ask this question.
I would just like to add one comment to that, is that one of the reasons that physicians in general don't want to get involved is because they don't want to get involved. They are afraid that once somebody says they're in the military, they're not quite sure how to respond to them. The fact of the matter is that there are really many resources that can be used where the doctor just, if they don't learn this information themselves, the doctor really just needs to refer that veteran's family or the veteran to one of the people that can help them. There are almost every state, and in fact every state has a Department of Veterans Affairs where people can help them. You can go to the VA website, which will give you a list of people that can help these veterans. And so if you don't know the information yourself, all you need is one good referral that you can refer all of these veterans to and have them get the help that they need.
Great, and on that note, I'm going to close our webinar for today. We just thank our presenters and everyone who has been in attendance. We invite everyone to join us for tomorrow's topic. We're going to be taking a deeper dive into the generational differences of veterans. We sort of touched on it in today's presentation, but that will be the topic for tomorrow. The video from today, as well as the presentation, we will make those available to you on the Joining Forces website as soon as possible. And if you could please take the survey as you exit the WebEx software, we would appreciate knowing how many people at least attended today if you were part of a group of attendees at your respective institutions. We hope that you have found this session to be a meaningful way to spend your Veterans Day, and thanks to all.